In the United States, Hispanic adults are 28% less likely to receive mental health care than the general population. For youth, the data points to an acute crisis. Latina teens report higher rates of suicide attempts than any other female demographic. To address these gaps, you can implement a month-long outreach blueprint designed to navigate cultural sensitivities and directly engage Hispanic families. Before launching, you need to establish 3 prerequisites: assemble a bilingual team, secure funding for offline printed materials, and identify local community partners. Without deep cultural context and a trusted local infrastructure on the ground, clinical resources often fail to reach the people who need them. The foundation of this campaign relies on recruiting Promotores, community health workers. This taps into personalismo, prioritizing personal connection to build trust organically. This 4-step training agenda for Promotores starts with cultural storytelling to build safety. Step 2 teaches mental health first aid for anxiety and depression. Step 3 navigates bilingual directories. Step 4 is open Q&A, affirming confidentiality and protecting immigration status. Your secondary pillar of trust is the local church. You can equip pastors and faith leaders to address religious stigma directly from the pulpit. You can see here how a standard printed church bulletin is updated to feature a bilingual help and hope section at the bottom. Provide faith leaders with specific talking points that frame therapy as an act of courage. By integrating mental health conversations into existing, trusted cultural pillars, you bypass the fear many families have of formal medical institutions. These trusted networks are especially vital when addressing the high suicide risk facing Latina teens. Your action plan here requires partnering with school counselors and PTAs to host bilingual family mental health workshops during events that parents already attend. You also need to implement culturally tailored youth programs. Initiatives like La Vida es Preciosa combine clinical therapy with activities like art and academic tutoring. When creating materials for these programs, avoid direct English to Spanish translations, which often sound unnatural. This outreach poster demonstrates culturally resonant messaging. Instead of a literal translation, the Spanish text, "Tener depresión no es un signo de debilidad," specifically states that depression is not a sign of weakness. Reaching the community also means navigating the digital divide. If your campaign relies purely on social media, you risk missing elderly and low-income Hispanic families. This split screen compares the dual approach. On the left, digital metrics track younger demographic reach. On the right, we map mandatory offline strategies, like airing PSAs on local Spanish radio stations and distributing printed flyers at union halls and consulates. This dual-track execution addresses both cultural stigma and physical access barriers at the same time. Matrix resources, 741-741 for youth, SAMHSA for adults, Elder Care for seniors, 988 for crisis, drive our 4-week calendar. Week 1 launches media. Week 2 executes school workshops. Week 3 hosts Promotores seminars. Week 4 measures impact. This rollout reaches families directly. You now have a 4-week blueprint designed to bypass the digital divide, address cultural stigma, and integrate bilingual resources into trusted local pillars. To begin, start printing your tailored resource guides and contact your local Promotores to schedule your first training session. Using these specific local partnerships establishes a direct channel for families to access bilingual care, removing the obstacles that historically kept these resources out of reach.